There are many reasons why research is carried out into contemporary health and social care issues. For example, to explore the effect of diet on health and well-being, or the provision and impact of addiction centers in the local community. As a health and social care professional, you will need to understand the purpose of research, how it is carried out, and the importance of research for improving the well-being of those using health and social care services. My name is Abraham Lawal, a lecturer in health and social care. As you are getting ready to do your examinations of your guided learning of 120 hours, this video is prepared for you as a reminder and part of revisions for you in preparation for the exams. Some essential content information that you may be asked during exams in different ways and manners, and which the answers will still be the same in whatever forms they are asked in your exams paper. Don't let the examiner confuse you. Be calm and read the questions well to know the best approach to write your answer. You must first understand what the question is saying, which is the first key to know the answer to provide. At least read each question twice and think about it to understand the question itself, and pay attention to some key terms typically used in assessment in your preparations. Remember, research into contemporary health and social care issues is conducted for various reasons, such as examining the effects of diet on health and well-being, or assessing the provision and impact of addiction centers within the local community. Health and social care professionals must comprehend the purpose of research, its methodologies, and its significance in enhancing the well-being of individuals utilizing health and social care services. Key terms typically used in assessment. These are some of the key terms used consistently in assessment by Pearson to ensure students are rewarded for demonstrating the necessary skills. Command or term health and social care practitioner. Definition: health and social care practice is used in relation to how health and social care professionals carry out their work or job roles. Health and social care services. Health and social care services may be used in relation to how services are provided and/or made available to the individuals that need them. Literature review. Literature review is an assessment of existing research around a particular issue or area of study. Issue. Issue may be used on its own to describe the subject of the research that the article is describing. Ethical issue. Ethically related aspects that may have affected how the research was carried out. Ethics in research are norms for conduct that distinguish between acceptable and unacceptable behavior in scientific activities. Primary research. Research compiled directly from the source, which may not have been compiled before. Term qualitative research. Qualitative research involves descriptive data, such as data drawn from open-ended questions in questionnaires, interviews, or focus groups. Quantitative research. Quantitative research is based on data in numerical form that can be categorized and used to construct graphs or tables of raw data, such as results of experiments, hospital data showing the admissions of individuals with certain health conditions, closed questions in questionnaires, etc. Research methods. Definition: research methods refers to how the research described in the article was carried out. For example, through quantitative methods such as analysis of figures drawn from hospitals or GP surgeries records, or quantitative based on focus group or questionnaires. Secondary sources research. Secondary sources of research refers to published research reports and data, likely to be based on analysis of primary research. What is the purpose of research in health and social care? The purpose of research in health and social care is to improve outcomes for people using services, to help inform government policy and practice for hospitals, organizations, and those providing health and social care services, to gain, extend knowledge and understanding, to identify gaps in service provision. Examples of research that have led to an improvement in practice and policy, for example, changes in the treatment of health conditions, and changes in practice in providing care and support. What are the issues in health and social care covered? Health conditions? Lifestyle factors, social care and welfare needs, health conditions, for example, how effective certain types of treatment are, health trends in certain areas or among certain age groups and why this should be the case, strategies for avoiding certain health conditions and the success of these strategies. Lifestyle factors, for example, prevalence in certain age groups, how far lifestyle contributes to health and social care needs, the effect on demand for services and what can be done to mitigate factors. Social care and welfare needs, for example, practice in providing care and support to individuals with specific needs, the success of these practices in promoting individuals' independence and well-being, services provided to individuals with specific needs and the effect of these services on individuals' well-being. What organizations or examples are involved in carrying out or involved in research? Health authorities, local authorities, social service departments, charities, community organizations, Office for National Statistics. What are the lists of common research methods in health and social care? Questionnaires, interviews, case studies, scientific experiments, checklists, observation. Let us pause for a moment. What is the difference between qualitative and quantitative data? How to conduct effective literature searches? Pause the video. Take your notepad and answer the 2 questions before continuing and see how much information you can recall at the moment without getting help from your laptop or the internet. Because during the exams, you will not have access to those. Okay, let's continue. As a researcher or anyone else who may want to carry out research, there are certain things he or she will have to take into consideration or had figured out before embarking on a research project. These will include the rationale for the research, the achievable objectives, selecting the appropriate research methods, selecting target group or sample, deciding realistic timescales, deciding how the research will be monitored and modified, deciding measures for success, considering ethical issues while carrying out research. What are the ethical issues to be considered during any research? The ethical principles in research reporting include maintaining confidentiality of participants, including any settings, ensuring that participants have given their consent, and if they do not have the capacity to give consent, you must obtain consent from their caregiver or from parents of children below the age of 18. Research conduct includes keeping a professional distance, data protection legislation, policies and procedures, and how this relates to the conduct of research. Legislation must be current at the time of delivery and applicable to England, Wales or Northern Ireland. Conflict of interest in research and how to avoid them. Peer review, including human subjects, mentoring, research misconduct, professional distance, disclosure, and whistleblowing. The role of organizations, for example, the National Social Care Research Committee. What are the essential skills that are required of a researcher, or to be considered or to have by someone who is wanting to carry out research? Time management and organizational skills, non-judgmental practice. Ability to show connections between sources of information, knowing methods of analysis and how to draw conclusions. Ability to recognize potential sources of bias or error, to know how to distinguish between fact and opinion and identify bias. Knowing how to select relevant numerical data. Analysis of results, including compilation of data results and findings. Use of methods of analysis valid for data collected, including triangulation, use of percentages, and use of statistical averages. Skills of making notes and keeping records from source material, reading techniques, for example, skimming and scanning, conventions for presenting bibliography and reference lists. What are the sources of secondary data? The sources of selecting reliable secondary data during secondary research include professional journals, professional bodies like the National Medical Council database, textbooks, periodicals, credible websites, and research organizations like the Office of National Statistics database. Let us paint a scenario. Alicia Key, as a student of health and social care, was tasked with researching health issues online. She has not previously engaged in this activity and is uncertain about how to proceed. What methods would you use to explain and guide her in this process? Considerations for information retrieval in secondary research include conducting electronic searches using academic search engines like PubMed, Google Scholar, Sage Journals, and so on. With your search questions based on the subject topic, you will be taken to the database of the search engine. Use appropriate keywords to search for titles or topics or your research questions, and use advanced search tools, refining search data to narrow the range of information to a manageable size. Gap. 3S. Finally, make sure you attempt all the questions in all 4 sections, because failure to answer a particular section will mean 0 marks for the section, which cumulatively will affect your final score and your final grade in the exams. Thank you. Wishing you the best in your exam.